Great. So moving on to actually treatment and recovery from Lyme disease. And I'm hoping you can give people some positive hope here. Do people actually recover from, this was a question that came up quite a bit, do people actually recover from Lyme disease, or does treatment just push it into remission?
Right. Well, antibiotics kill bacteria. So if you catch it early, you've got a better chance of curing people. I told you the studies that late Lyme disease, only 30% of people get cured with 2 weeks of doxycycline. I saw a priest from the Wicklow Mountains. He's a film director this spring. He saw one of our signs on tick prevention, and he got a bullseye rash, went to his GP, demanded doxycycline. He had a really horrible meningitis, headache, felt poorly, but got started on antibiotics within a day of him seeing the bullseye rash. He was sick as a dog for a week with a viral meningitis. He came to see me 2 months later. He'd received 3 weeks of doxycycline. He was cured, because bacteria can be killed with antibiotics. Now, if it takes 2 years to diagnose you, at that stage, I think the bacteria is embedded in the tissues. It's no longer in the circulation. There's lots of damage to the immune system. There's damage to the autonomic nervous system. There's inflammation. There's autoantibodies. It's more difficult. And there's a theory that Lyme goes into biofilm, goes deep into the tissues, and it's hard for the antibiotics to penetrate. But my understanding is if you treat properly and you do the right treatment and repair the immune system, you can cure Lyme. People talk about remission. I'm in remission. This is not cancer remission. You can cure Lyme, but not everybody gets cured with the antibiotics. Sometimes I think what happens is the infection is 90% cured. Your immune system recovers and you're controlling the infection. And then 5 years later, I've seen this happen. You get COVID and then, bow, everything comes back again. And then you put people back on antibiotics and they get better again.